Poultry farming is one of the most rewarding livestock enterprises that can be done both at a commercial level and subsistence level. But for one to realize the profits in poultry farming, one has to reduce on the expenses, especially the treatment expenses. And this can effectively be done through implementation of biosecurity measures in a poultry farm. And these include vaccinations. So when you do not do biosecurity measures, sometimes you find yourself incurring lots of costs in treatment of various diseases. There are several poultry diseases that can just be prevented very effectively through implementation of biosecurity measures that include vaccinations. A number of diseases such as fall typhoid, Newcastle disease, infectious bronchitis, fall pox, and several others can simply be prevented through vaccination exercises. Right now, we are about to begin vaccinating these light Sussex birds with Newcastle and infectious bronchitis vaccine to prevent them from catching Newcastle disease and infectious bronchitis. Just watch. Hurry up. An effective vaccination exercise, you have to first ensure that the birds are healthy before you vaccinate them against any disease. Otherwise, if you vaccinate them when they have an underlying disease, when the immune system is already battling any underlying disease, which can include worms, which can include coccidiosis, then you end up causing them to succumb to even that disease that you may be vaccinating against. By the time you vaccinate when they're already sick, the immune system is already occupied fighting another disease. So you have to ensure that the birds are healthy enough before you vaccinate them, and then you vaccinate them. Right now we are vaccinating these light Sussex birds against Newcastle disease and infectious bronchitis. And by doing this, we are sure that we have protected them by over 90%. That they will not catch Newcastle disease or infectious bronchitis. When you are vaccinating, you also have to ensure that you maintain the cold chain. The vaccine has to remain in a cool box within temperatures that are very cold, and you ensure that the vaccine remains viable. It's not exposed to sunlight and remains in cold, and then you use it to vaccinate your birds. With Newcastle and infectious bronchitis vaccine, we put 2 drops in the eye of a diluted vaccine and we release our bird. Thank you so much as we implement these biosecurity measures.